2.
Hello there. Welcome to another episode of Facebook Live. I hope you're having a great day. It's another awesome Wednesday, and today I've yet to see a raindrop with my eyeballs being open, and that is unique in these last few days. So we're super thankful to be with you. We're super thankful to continue to help patients, and thank you for taking time out of your day to join in with us. So today, I was thinking the supplement of the day that we would talk about are Insomnitol chewables from Designs for Health, because I love them. They're amazing. And so these can really help you sleep if you're having any sleep issues. And it doesn't have any diphenhydramine like Benadryl in it. A lot of folks that take this don't have any hangover effects, and my children actually take it, so they're going to be super excited today when I bring this home for them, because they've been asking for it for a long time and we've been out. So the ingredients include some vitamin B6, which you can get in some over-the-counter products. It also has some inositol, L-theanine, 200 milligrams, 5-HTP, and melatonin. So rock it. You take 2 tablets before you go to bed. They are a little sizable, so just remember not to try to swallow them whole, because my son did that and almost asphyxiated. So be sure you chew them up. Okay, so don't forget Insomnitol chewables. They are awesome. And your kids can take them too. So if your children take them, I just recommend that they start with 1, but you could always go up to 2 if you need. And sometimes my husband also takes some GABA with us. So like Pharma-GABA at 200 milligrams helps him sleep too. So just letting you know, you could take them together, you could take one or the other. As far as events go, we continue, Lauren keeps doing her Women in Weights, and I'm excited about that. You know, certainly I know there is just fear in the weight room when we are women so many times, because we just didn't have a lot of instructions. And as we continue to walk on this plant, the less we know, the more intimidated we are. Well, don't be intimidated by weights. Weights are awesome. They help keep you strong, and you couldn't have a better teacher than the lovely Lauren. So feel free to come and be part of that if you would love to learn more and get less intimidated about the weight room. We still have our boxing thing, kind of going on. And then we just continue to work on our events. I know school's getting out here soon, lots of graduations. And I also know that with some of the rainier weather, more people are calling because they think, I think I want to feel better than this. But isn't it fun? The sun is energy. And when the sun goes away and we don't get to go outside and run around in circles and play in the yard, we feel not ourselves. So just a little testament that the sun is energy and being outside is good for us. So what we're going to talk about today is the procedures that we do for women, and kind of help people know the experiences of what they're like. So if you were to ever want to have one done, it doesn't seem so scary and you understand more. So first, we're going to start with laser hair removal. So laser hair removal, you literally can do anywhere on your body, and it's actually super fast. We use the Soprano Light, which is an Alma product. And so how laser hair removal works is it targets dark hair follicles, because if you have white hair, it won't work because the white hair doesn't have pigment. So the laser is actually looking for pigment. Also, you can't really laser over tattoos because that would burn you, because a tattoo has dark color and the laser is taken up by dark color, and so it hurts. But like, we had a patient come in for his back the other day. It took us like 5 or 10 minutes. It does not take very long. The laser hair removal, we have some either stamps, where you can do it in motion. So in motion, it heats the tissue up. Now, where the hair is more concentrated, it gets hotter faster because there's more dye from those hair follicles absorbing the energy of the laser. And so if the first time you have laser hair removal, your hair is more dense. Hence, it might be slightly more uncomfortable. Not horrible pain, but just slightly more uncomfortable. So if that area gets uncomfortable, you just stop doing the laser hair removal for a little while, and then you go like this, and it gets really cold and it feels good. So know that you can stamp, or you can do in motion. Bigger surface areas, we a lot of times do in motion just because it's faster. Laser hair removal you do about every 4 weeks, because if you wait too short, hair follicles grow every 4 to 6 weeks basically. So you don't want to treat too early and miss the hair as it grows, and you don't want to treat too late either. And certainly you don't want to pluck in between treatments, because if you pluck it out, you literally take the target for the laser out, and then the laser hair removal won't work so good for you. So don't wax, don't pluck, don't do anything, just shave in between. And it's best for pigmented hairs. And the other thing about laser hair removal is you can do it anywhere on your body, on your face, on your neck, in your armpits. We've got people that do it around their breast, on their happy trail of their stomach. Guys do it on their back. Guys will do it on their chest. We'll do it on legs. You also can do it totally in your, like do a Brazilian. You can do it along your bikini line. You can get down on your labia. We have women that do a Brazilian and they flip upside down and you laser right around their kind of the rectum and their anus. I just say, man, that is a woman that has that happen to them, because gosh love it, they'll totally take that. I haven't quite gotten up the gumption to do it yet myself, but you can do it if you want to, and it works really great. And it feels super slick, so nice. And the other thing some people had asked is, does it predispose you to folliculitis or any other issues? And it actually, with laser hair removal, helps prevent folliculitis and some other skin issues of the labia and perirectal area. Some people actually do laser hair removal for pilonidal cysts, and so pilonidal cysts, they get this big kind of goomba, if you will, an infection at the top of their gluteal fold, right between where your bottom cheeks are, and so laser hair removal can help those folks as well. Not if they have an infection, but to help prevention and treatment of the hair follicle around it. So that's just good to know. And yeah, oh, you can also do laser hair removal in a man's ear. So we have this little tip that you can do too, because ear hair can be burdensome. And with guys, when their back is hairy and they're out in the sun in the summer, they can feel it. It bothers them. So this really helps them too. So for women, of course, you can get around your areola. Of course, you can get your happy trail. You could do anywhere on your legs up to your bikini line. You can also go up on your labia. Perirectally, you can go anywhere you want to go, just as long as the hair is pigmented. Then the next thing we also do is we also do a labiaplasty. So if you think, what the heck is that, and why would someone do that? So labiaplasty just means we help your labia change shape. And some people feel like their labia are bigger than they should be. Now, I've looked at lots of labias, and everyone's labia is normal, because that's a lady's labia, right? And so what's abnormal, I'm not quite sure. But if they feel too large, and some people actually have to like fold them, and they feel really self-conscious when they're in their swimsuit, they feel like people are looking and it looks bulky. Sometimes maybe they really love riding a bicycle and they feel like their labia getting away. Well, life is hard, labia are easy. And your labia are very forgiving, meaning they're built for you to have a baby and get injured, so you have a lot of lymphatics and you don't really get any crazy infections in there because your body's built not to. So a lot of times you can go to sleep for labiaplasty. We'll do a lot of them in the office. So what we'll do in the office is we actually inject local numbing medicine in the labia itself, but first I mark it. A lot of times I'll cut out like a diamond-like part of the labia minora. The labia majora is the hair-bearing labia skin folds on the outside, and then you have the labia minora on the inside. So it's the labia minora actually usually that get a little bit redundant, if you will, a little larger. Some people actually have a labia, like your labia minora could actually just be like a little half moon shape, but sometimes it comes out and then there's this thing that kind of sticks out like a little wing and goes down. Well, that little wing tissue just can kind of get kind of burdensome in times. So if someone comes in, I look at their labia and I ask them, what bothers you? And then they'll point that area out, and then we kind of figure out a way to make it better. If they're nervous for someone to touch them in the office and don't think they can sit there for very like 30, 45 minutes, then you could always do it in the OR, but we can totally do them in the office as well. So after you inject the local numbing medicine, you cut out the redundant skin, and then you just do interrupted sutures along the line, and it looks really nice. I'll tell folks not to have sex for a good 4 to 6 weeks, simply because, you know, after you have a baby, you don't want to have sex for 4 to 6 weeks. After someone messes with your labia, you just do not want them to move around a lot, and you don't want to go to kickboxing, you don't want to ride a bicycle, but the labia actually heal up really well. And you shouldn't have any sexual dysfunction like pain with intercourse afterwards, and notice really hopefully no sequelae after it was performed. So it works great. You come back 2 weeks afterwards, and it's easy and done in the office. The other thing too that happens as us lovely ladies is, you know, we walk, we're bipedal organisms, we have babies sometimes, and our labia can change shape because of all of those events. So also, just with kind of life, not only do we have the way we were born, but we have the way that we've been stretched by life's experiences. And so if that augmentation of anatomy causes you an issue, life is hard, your labia are so easy. So we totally got that. And there's totally no shame about talking about your labia, because if they don't bother you, then you can focus your energy on other things, and there's plenty of other things to focus our energy on. So that would be a labiaplasty. So the next thing we also do is we do the FemiLift, right? So the FemiLift is, vaginal rejuvenation is this term that there's lots of different machines out there. Basically, they're all trying to do the same thing, and they're just doing it in a little different way. So everyone will say their product is better, but it's all marketing. And I happen to like our product I happen to like our FemiLift just because I like the amount of time it takes. I like that I can individualize it for the patient, and I can use the machine for so many different things. So I do love our machine, but I'm going to sit here and acknowledge that anytime you're going to help collagen, you're going to help a girl have a better day. So what the FemiLift does is it helps with stress urinary incontinence, vaginal lubrication, and some people have also had improved orgasms. When you think about the vagina is just a tunnel, and all sensation for women sexually and in her vagina is on the outer 1/3. The upper 2/3 of our vagina we cannot feel, and that is why we can lose tampons out there. And when a woman comes in and they've lost a tampon, they're completely horrified, but I tell them, totally don't worry, because it's a horrible smell and people don't know where the heck it comes from. And so when you pull that out, they're good, on their way. Life is hard. Retained tampons are actually quite easy. So anyway, but the FemiLift, what it does is it takes a laser, diffractionates it, and it just goes a little bit into the vaginal tissue and causes collagen to regenerate itself. So it works really good, but it literally doesn't hurt. It doesn't hurt until you start getting to the outer 1/3 of the vagina, because again, that's where all those nerve fibers exist. Now, the other thing I'll find is that a lot of people, as we become postmenopausal, where it hurts is actually the opening to the vagina. So if you're going to do a FemiLift, you'll be like, dude, you're missing what hurts. It's like with insertion. And so what I'll do for those patients a lot of times is I'll actually numb up the introitus. The introitus is another word for the opening of the vagina. And I'll actually laser over the top of the outside of the vagina, and it doesn't hurt. They do great. And then they stop feeling like it splits every time that they go to have intercourse, because splitting does not feel good. It's supposed to be pleasurable, and when you feel pain, it makes you not want to have it on top of other things. So that is the FemiLift, and there's no downtime afterwards. You go home, you're just supposed to not have sex for 3 days. Now, I'll tell you, if you want to watch me have mine, that is one of the archived sites on our YouTube channel. So if you go to the website and look, you can watch me have my FemiLift, so you know I'm totally not joking you. I'm not screaming. It takes about 3.5 minutes, and it's super easy, and it totally works. Really, so many of us have stress urinary incontinence after we have munchkins, and we just think we can't jog or do other things, and it's just not true. There's no reason that you have to give up your sense of self, because your body's regenerative until the day you die, so help it feel better so that you can have the best day ever. So that is the FemiLift, and then the next thing we would do for women is the Secret I would talk about. So the Secret helps with stretch marks, helps with cellulite, and it helps with wrinkles and skin texturing. And so basically, again, what that one does is we put local numbing medicine on. You come in, it puts the energy underneath the skin and also goes through the outside dermis. You look a little red usually for a couple of days, or not a couple of days, a couple of hours, but usually no one knows you actually did anything. Now, the other thing, again, we have to remember about our body is our skin is skin, but it heals different in different areas of our bodies at different speed. So if you do something to the inside of my vagina or the inside of my mouth, I'm going to heal like a champion in not too long at all. Then if you do something to my face, that's going to heal the next fastest. If you do something to the back of my hand, that's probably going to heal the next fastest. But if you do something to my stomach or my legs, it takes longer. So when I secret my face, it looks a little red for a couple of hours, and then that's it. But when I secreted my leg, it looked like a really crazy cat scratched my leg for about 7 days. So if I did it in the summer, it might look a little goofy, but the cool thing is it totally works. I secreted one leg and not the other, and I only have done it once so far because I don't like to sit still too long, and I totally can see a difference. So when I get to it, I'm going to get to that other leg. And I think I'm going to do it a few times over because it looks good, and it keeps my skin from looking like it's falling off my body, and I just like trying to prevent that. It makes a girl feel better. So I think that's a secret, and what I would say about that. You can use, of course we use like neurotoxin. When I say neurotoxin, we can use Botox or Xeomin, or there's another new product that we're also going to trial out. That just feels like you get little pricks in your face. And again, you can go to the website and look at the YouTube channel, and I injected some of my face on one of the Facebook Lives, and you can see how that goes. It just feels kind of crunchy here, and a little like pokey, like a little mosquito is kind of biting you, but it doesn't hurt, and it takes about 48 to 72 hours for you to look at the mirror and see that you've had that benefit. Now, we also inject filler. You can inject filler in your lips, you can inject filler in the mid-face, you can inject the filler with marionette lines. So when you think about filler, just think about a road and a pothole, and all you're doing is filling in the pothole so it doesn't have a bump anymore. And a mid-face filler, when you inject, you go right above the periosteum of the cheek, and it just kind of fills it out a little bit. Really, there's no downtime really associated with that. There's local numbing medicine in it. And so other than the thought of someone's putting something in there, people tolerate it really well, and you get immediate results, which people really like. I usually don't try to put filler in at the same time we do a secret, because I like to, and I don't really put like neurotoxin like Botox or Xeomin at the time you do a secret. I separate them out by a couple of weeks. And it works really good because it's nice to kind of combine those procedures together for people. Then if I was doing cool sculpting, so of course we could do cool sculpting for women just like we could do men. You can cool sculpt this bra fat, which is really a popular area with summer coming up and dresses and tank tops, and you can also do bra fat back here. You could do chin, you could do stomach, you can do flanks, you could do the banana peel, and the banana peel is this area right behind underneath where our glute is. You could do knees. I've seen little pockets of fat in the most unique areas, and as long as you can get that little cool sculpting template on there, you can make it work. So with cool sculpting, you come in, we mark you, we take pictures, you sit here anywhere from 30 minutes-ish to about an hour, depending on the template used and the transducer that's used, and then afterwards, you're literally done. So for 2 minutes after the treatment cycle is completed, we massage the area, which could be a little stingy and feel a little tingly, like you take your glove off when you come in from a cold day into a warm environment, and can be a little uncomfortable. But after that, usually people just feel numb for a little while, and then their sensation returns. Usually there's not a lot of bruising or discoloration of the skin, although some people can have those types of things. So hopefully that helps explain some of those procedures that we do. We do these procedures for women just like we do for men. Ooh, and let me get to the shockwave. So shockwave, I forgot. So shockwave we use for males for erectile dysfunction, but you can use for females for sexual dysfunction as well, because the FemiLift does inside, but the shockwave does the outside. So we use it on the clitoris, on the labia, the epidendals, which are the nerves that feed our female genitalia, and we also do the G-spot, which is just right up inside the vagina, arched right behind the pubic bone. So again, there's no downtime after that, and I've done that for several women now, and I think everyone has been very pleased with the results, and they're just more aware of their body and their anatomy, and it makes them happy to connect with themselves. So yeah, basically anything of your body that's kind of not bumming you out, but you just think, if this wasn't here, I would feel happier. Then I just think you should open up and talk about that, because we just have too many options to feel like you shouldn't be able to connect with yourself. Because I know I say the same thing over and over again, but life itself is hard. Your body is so easy. It's regenerative and it wants to be good if we just kind of speak its language. So, and it feels good when you're connected with your body, because you feel more peaceful, and life just gets a little bit better. So I don't think there was anything I left out. Do you have any questions or anything?
We do have some questions.
Okay. Ooh, I love questions.
They're about specific procedures.
Okay.
So, for example, laser hair.
Yeah.
What is the downtime like? What does it feel like? And what's kind of post-treatment? What should you be doing?
Okay. So really afterwards, we tell you be careful being in the sun, hydrate yourself, stuff like that. So when I first did laser hair removal, I was completely petrified to be in the sun. I drank all this water, but I'm gonna not lie and say, because I did go out and mow the grass. So when I mowed the grass, I thought, am I getting dehydrated? Is something weird happening to my skin? Am I burning? And nothing bad happened. So all I would say is afterwards, you just want to make sure you drink some water. You might be a little bit more tired, but really there is absolutely zero downtime. Now your legs may still feel a little hairy for a couple of days, but the hairs will fall out. So if you still feel hairy, it's not that it didn't work. It just takes a couple days for the hair follicles to fall out. So in the darker hair that's more concentrated, it's going to just be slightly more uncomfortable, because there's more hair being treated, and it gets warmer the closer the hair follicles are. So the other area that you can feel a little bit more is like right over your shin, because you don't have a lot of like soft tissue underneath. So if I do my gastroc, which is the back of my calf, I could do that all day long. But if you start going over my ankles and go slow, then I'm like, can you please go a little faster? So that is how I describe. Now, doing under my armpits, I've got more concentrated dark hair. It gets hot fast and it feels more uncomfortable. Around my labia, there's more dense hair that's concentrated, so I'm a little, plus the area's a little bit sensitive, but it's built to be that way. So that is how I would describe laser hair removal. There's really absolutely no real downtime. Just drink a lot of water and just don't pluck it or wax it, and come back in about 4 to 6 weeks for your next treatment. Pardon me? Oh, I say, a lot of times I would anticipate about six treatments to start with, about 4 to 6 weeks apart. Because each time you treat it, there's less hair to treat, but we're just trying to make sure that we've gotten like every hair there. And again, we use the Alma Soprano Light, the Soprano Ice, and I love that laser hair removal machine. It just works really good.
We do have a question about the labiaplasty. So
Yes.
how would one know if they were a candidate for this, or what would make someone a candidate for it?
So I've heard so many different things. Like I've had 18-year-old girls come in and say, I don't think my labia are normal. I will not go out in a swimsuit. I feel very self-conscious about this. Because I think there's a lot more on the news and TV about our labia than I ever knew. Because when I was growing up, I just petrified to even know that I had labia. And so now it's all over TV. People are having these things done. So what the heck is normal? It gets kind of distorted. So I've had other women that actually have had to fold their labia in. So I would say if your labia are bothering you in any way, if you feel like they itch, not itch like an infection, like yeast infection, but you have to fold them and there's so much tissue, it's just hard to feel comfortable. But anyone could be a candidate if it bothers them. So I look more to who's the candidate for who wants it, because this is nothing that we're going to your insurance for, anything like that, it's more of a perception of your own body. So I would just say anybody.
Now that summer is coming and we're here towards the end of May, what would be the best skincare treatment with the best, or I guess most minimal downtime?
For summertime? So in summertime, you don't want to do like a CO2, because the CO2 is like burning you, with like kind of a controlled burn. And you really want to be careful going out in the sun, because your skin is like little baby skin after that. It'll burn really easy after. So any CO2 treatment, you want to wait for the fall. And don't forget Dr. Moss study, because we'll do it then too. You can do it in the summer if you don't want to go out in the sun, but that's not very many people. So the secret, I think you could still totally be able to do. Now what happens with laser hair removal is if your skin gets, the machine that we have, you can still do laser hair removal in the summer. But if you're super tan, we just have to up the settings, because the melanin deposit in your skin, it gets darker. So that's going to target, the laser is going to target that pigment a little bit more. So you can still continue with your treatments, but know that we have to just adjust the settings, because you don't want to be super dark and for us to laser you like your skin is super light, because then it burns, and burning is bad. So we don't do that to you. So that treatment you can do over the summer, although we modify it. You could do the secret too, but still your body is undergoing collagen regeneration, so you don't want to do the secret and go out in the sun the next day on the boat, because your skin would be unhappy. And let's see here, as far as, you could cool sculpt no matter what time of day or what, you'll be fine no matter what you do there. The FemiLift you can do anytime. You can do Botox and filler anytime. Shockwave, you can do that anytime too.
What is your favorite treatment?
I don't know what my favorite treatment is. I love them all actually, but I think one of my favorite treatments I would say my two most favorite machines. Number one is the Secret, because people just love it. They have like really great results, and you can use it all over the body, and people don't have a lot of downtime, so it's win, 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 win. The other thing I really love is I really love that Shockwave machine, because not only does it help men with erectile dysfunction and women with function, but I use it all the time for these soft tissue injuries, and so we've had such great results with plantar fasciitis and all this foot pain that people have had to live with for a long time. And they're finally able to move their legs and their feet a little bit more, which makes them happy, because your feet are force generating, and if your feet aren't happy, then you're not moving the energy through your body well, and it makes it hurt. So I've just like watching people get better, and so I really love that Shockwave therapy, because it's also treating your body with sound, and it's so cool, because so many times, I went to medical school thinking I have to cut everything and sew it together, and now I'm learning about so many different ways to help the human body heal, by how you talk to people, by medication supplements they take, by how they move, by sound wave. I mean, awesome. So those are my two favorite machines. But I do love a good labiaplasty. I mean, I'm not going to lie. And so I also have to say that I still do like hysterectomies, hysteroscopy DNCs, because I grew up doing that. And they are just like my third arm. It's just like, that's what I do. So I also have to say, when I do a hysterectomy, when you get in anteriorly between the uterus and the bladder, it feels so soft, like a silky sheet. And I'm like, oh, I'm there. So that might sound kind of crazy, but I like that. The other thing I love about a hysteroscopy DNC with resection of a polyp, so if you think about your uterus, I know that I'm going too far about this, but I'm just saying what I like really love. And so your uterus inside is like a balloon. And if you have a polyp, it's like a little stalactite inside. So you go in with a morcellator and you put it in and it sucks it in. So it's just like playing a video game and watching you kind of chew something off, maybe like Minecraft or something, I'm not sure. So that I also find really exciting. And then I really do enjoy posterior repairs too. Posterior repairs are where we go in the vagina, because when you think about the vagina, it's supposed to be, we're born with it being a tube. But when we have babies, the opening down here opens up. So instead of it being a drop off like we're born with, it becomes more of a slant, and it's more open. It's more of a tributary instead of a river. Like it gets more of like a triangle. And so what happens is this here, from here to here, goes away. So when you do a posterior repair, you go inside the vagina, you kind of peel the vagina apart, and you sew it back up so it's not like a river again like this. What it is actually is you build it back up so it goes out and down. And when you look at it, you're like, oh, it's right back how it started. So it's just fun to watch the body, to be able to transform the body in that way and kind of help it fill in things that people may want to change. Not that they want to change that, but if they did, I really enjoy seeing the result of restoring anatomy. It's just fun. So that's what I love.
So we have a question with the National Women's Health Week.
Okay.
What would you say is the biggest benefit, or what is the one thing that you wish women would take advantage of during National Women's Health Week in terms of their health, female health?
All right. I could say a myriad of different things, but I think what I'm going to say is I would hope that you would take 15 minutes for mindfulness. That's all. Because I feel like so many women are acts of service of love, and they give to the world before they give to themselves. And when you get to menopause or perimenopause, it's the time that you start to feel like you break. And it's not selfish for self-care. It's important for self-care. So I really feel like if you balance the stress in your body wants to be well, and we would have so much less chronic disease. So if I was going to get to the root of changing as many health problems, I would say, I would hope that someone would find 15 minutes of mindfulness, and daily would be amazing. And when I say mindfulness, it doesn't have to be as hard as getting on an app and like taking a bubble bath with candles. It's just because I know our lives are crazy and time is an issue. I would say at least if you would just pull your car over or your bike over or take a walk for 15 minutes and just stand there and breathe and look at the sky and feel the trees and just feel connected, then that would be the biggest health benefit that anyone could do. And if you don't feel good, don't be afraid to ask for help.
Awesome. All right. And then just a question about how would you describe how you talked about how laser hair would feel. What about like the secret or cool sculpting? What does it feel like when you're doing those procedures?
That. So when you do the secret you put numbing medicine on, and I thought it felt really weird because I can't feel my lips. It feels so different, and you really can't feel. So when you wash your face, you're like, I can't feel my face. It's so odd. So, but when you lay, it just feels like ta-ting, ta-ting. You just feel like something's going in, but it's not painful or hot or bad. And then afterwards, you put cream on and you stand up and you're like, okay, well maybe my face felt a little hot for like 15 or 20 minutes, but it totally went away. Now with my leg, when I did it, my leg was hot for about 2 hours, but it went away. But I put on my leggings right over the top of it and went about my day, and it was great. Because when you do a CO2 with your face, you want to be super careful not to lay on a dirty pillow, and what face products, you don't want to use old-fashioned products to put bacteria in your skin, because your skin is really injured. And you don't want to seed bacteria on a burn, because that would make it infected. But with a secret, I mean, you're usually pretty good, so you don't have to worry about those things. I would say CO2 on my face, it was uncomfortable, I'm not going to lie, but it gave my skin baby but smooth skin, which was nice. I just looked like a shedding snake for about 7 days after I did it. So the secret is a much less painful way to get there. But, you know, you kind of have to repeat that over a couple of times to get those similar results. The other thing was, cool sculpting. So cool sculpting is you sit there and you put the gel pad on, and we put the gel pad on because the gel pad protects your skin from getting frozen. It feels cold and gooey. And then after that, you put the device on, and the device just kind of pulls you into the machine, but it doesn't hurt. It just feels a little weird. Now, if you do the yellow transducer, it's a little bit bigger, and especially if you do it of your upper abdomen, like underneath where you breathe, it can, kind of takes your breath for a little while. The banana peel, I don't think feels too bad. The chin sometimes can make your head hurt, like right back here, but we just have to move some pillows around to make that go away. And I would say when we do men chest, they're a little like, ugh. So yellow upper, men chest, probably are the two most uncomfortable parts of that. Now, the other uncomfortable part is after you take it off, you have to massage for 2 minutes. And some people have a little bit more sensitivity than others, but that 2 minutes of massage can be uncomfortable. Plus, no one screams or anything like that. It just, you can feel it. I feel like that feels like in grade school, we'd always, on taco day, you always have your Mr. Icy that you squeeze, do you know what I'm talking about? So whenever you massage the cool sculpting afterwards, I feel like a Mr. Ice Freezy, because it feels like you're just crunching it up, which is actually kind of cool. And that kind of softens down. And it's cold for a little while. For about a week or two after you cool sculpt, if you go to the gym and jump up and down, you're just very aware of where you were cool sculpted, and your brain just gets slightly irritated because of that. It's not painful, it's just awareness, and it's different. So that is how I would describe cool sculpting to someone if I needed to describe it. Femilift, nothing. You just have some discharge for about 3 days. Shockwave therapy for sexual function, nothing. Shockwave therapy for your Achilles, for your knee, for your foot, absolutely. You stand up and you just feel like you got the best massage ever. Some people walk out and immediately feel a lot better. But cumulatively over time, with increased flexibility, they continue to improve their results. Cool. All right, well, thank you so much for joining in with us. I'm super excited to have yet another fun Wednesday with you all, and we're just thankful for you, and we're thankful to be part of your lives, and never hesitate to let us know if you have any questions, and tune in for next week, because we're talking about the procedures that we do for men, and we'll talk a little bit more about laser hair removal of chest areas. Maybe I'll try and drum up some pictures, too, so people can see some rockin' results. And I'm going to talk a little bit about erectile dysfunction again, because I feel like we can keep hammering away at that subject. I had another patient that I saw earlier this week, a male, and he came in with his wife, and he'd had an injury and had been thinking about a procedure for a whole year before he came in, a whole year. And it's not that whole year he felt great, that whole year he was suffering. And I just felt bad that someone suffered that long and felt like they couldn't talk about it, because oh gosh, that really makes you feel isolated, and life is hard. The human body is easy. If you just kind of reach out and talk about it, at least we can start the process of getting better. So, yay. You guys have a great day, and we'll see you next week.